Hospital is a very scary place. No matter why you go to the hospital, if you're the patient or the family member, it could be very intimidating. And the main reason is a lot of people work in the hospital that you don't know. Different type of doctors, different nurses, different ancillary staff with different color scrubs and stuff who come to your room and they want to do stuff to you, but you have no idea who they are. So it could be scary. So as someone who's been working in the hospital for years, I decided to break this down for you and make it easy for you. Stay tuned. Welcome back, people, to the Chatter Docs. I'm Dr. Tor and I'm an internal medicine physician working as a hospital medicine physician. If you're new here, don't forget to subscribe and hit the notification button. Also, like and comment and share the video with your friends. As soon as you go to the hospital, you're immediately surrounded by all these different people in different colors and shapes of scrubs or white coats with different names, different badges, MD, DO, RN, CRNP, CUB, PTB to the A to the Z, to the B to the A, to the A to the B. Each of them have different roles like attending, fellow, resident, nurse, scrub, something, respiratory technician, practitioner, blah blah, and you have no freaking idea who they are. And on top of that, things are very fast-paced in the hospital. People come in, they introduce themselves, they say, "I'm Dr. blah blah, I want to do blah 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 to you," and you're like so confused and you don't dare to ask more questions because you don't want to look stupid and you don't want to be known as the picky patient. Also, you're in pain and shit, so this can make a frustrating situation for you. Well, I hope you never go to the hospital, but let's face it, someday you will. Plus, we gotta make some money as well, right? Money, money, money. So you better be prepared for it. So I'm gonna break down all these roles for you and I'm gonna show pictures of how they may look. And on top of that, I'll tell you how much they make on average as a fun fact. Now let's roll. There's essentially 3 teams in direct contact with the patient: medical teams, nursing teams, and ancillary staff. Attending physician. What is an attending physician? They are physicians not in training anymore, and they're the most senior doctors in charge of your care. They can have different specialties or subspecialties, and they can be either the primary doctor in charge of your care in the hospital or see you as a consultant. They usually look like this or this, and their badge look like this. They could be MD, which means medical doctor, or DO, which means doctor of osteopathic medicine. Basically the same. Their salary depends on their specialty and how much they work, but it averages between 150 and 250 grand per year. Of course, the surgical specialties or cardiology or GI and other specialties that do procedures are paid higher, even up to 1 million per year. Not me. If I got paid that much, I wouldn't be making YouTube videos, okay? What is a hospitalist? This is a hospitalist. Hospitalist is your primary doctor in the hospital, which is usually internal medicine or family medicine specialist. They see and examine you every day, they put orders, and they're in charge of your admission and discharge. They may consult other specialties to help with the care as well. Oftentimes, especially if you go to a teaching hospital, different people come into your room and introduce themselves as your doctor, and they start asking the same questions and doing the same things to you. Or sometimes they all come together and freak the shit out of you. This is basically your medical decision-making team, which is led by the attending and has different other members, including different trainees. Before explaining their roles, let me tell you about medical training. After high school, there's 4 years of college or pre-med, and after that, there's 4 years of medical school. After that, people will go into residency, which is 3 to 5 years of training. After that, they can go into fellowship, which is subspecializing further, and that could be 1 to 5 years as well. On your medical decision-making team, you may see 3rd or 4th year medical students, residents, PGY 1, 2, 3, 4, 5. PGY means postgraduate year, and also fellows in training. Medical students, a person who studies and works hard with a false dream of becoming rich someday. They know everything and nothing. They oftentimes embarrass themselves in front of others. They look like chefs or barbers in their short white coats, and their pockets are full of books, iPads, hammers, ophthalmoscopes, and stuff like that. They will ask you all the irrelevant questions in the world. Please bear with them. They're still practicing. And also don't ask tough questions from them. Their salary is negative 50 to 80 grand per year, pretty much. Poor peeps. Residents. They are certified doctors who have finished medical school but still don't know much. They work a lot. I mean, a lot. They work 80 to 90 hours per week. That's why they're always sleep deprived and disheveled, especially if they're surgical residents. Sometimes they're even distraught and suicidal. They're basically the doctor bitches of the team. They take verbal orders from everyone and ironically sign all of the orders in the computer under their names. They are usually supervised by other higher level people like higher level residents, fellows, attendings who could be either in-house or on the phone. Their salary is between 50 to 70 grand that they can never spend on vacations, and their badge look like this. If you need anything regarding your medication or your disease, talk to them. Otherwise, if you ask them for water, please be prepared to die of thirst. First-year residents are called interns. They're basically the bitches of the bitches, so like the bitchest level. The higher the postgraduate year goes, like second year, third year, fourth year, they become more experienced and more senior, and sometimes more asshole. Fellows. They are doctors who finished 1,000 years of medical school and residency and were stupid enough to stay in training for other subspecialties. They have more experience and authority than residents, but they are still supervised by attending physicians. They look exactly the same as residents, so how the hell could you tell? And their salary is between 60 to 80 grand per year. Now again, as I said, all these people except for medical students are MD, medical doctor, or DO, Doctor of Osteopathic Medicine. Quick point, scrub colors are not universal. They're optional by the institution or by the person, and they can be any color or shape. Don't judge the doc by the color. The very first people that you meet in the emergency room or on the floor, and the people who you meet most frequently, are the nurses. Now, why am I talking about nurses after doctors? Because I'm a doctor, and doctors are more important than nurses. Remember it. I sincerely hope that the nurse manager on our floor doesn't see this video. If you're watching this, Ginny, I'm sorry. Nurses are your buddies, your best friends. They check on you regularly and you can tell all your annoying, endless needs to them. Just buzz them. Buzz them as you wish. Buzz them more frequently and they will love you more. The nurses usually look like this or this. Their badge usually say RN, which means registered nurse. They work 12-hour shifts, usually 3 or 4 nights in a row, and they get paid 65 to 70 grand per year. Their supervisors are called charge nurse or nurse managers on the floor. Now you thought you knew everything about the nurses? Gotcha! There's more and more to it, only to make you more and more confused. Advanced Practice Nurse or APN is a nurse who has taken additional training beyond nursing school, usually 1 to 3 years. The most common that you see in the hospital are nurse practitioners or NPs. They usually specialize in a specific field like mental health, pediatrics, OB/GYN, and so forth. They can see you independently and put orders, or in collaboration with another attending physician. They may look like this or this. There's also another role in the nursing staff, physician assistant or PAs. They have done 4 to 6 years of education, usually bachelor's or master's degree, and they're involved in the medical team, in the clinic or in the hospital, but they're always supervised by a physician. They also could look like this. See, they all look the same. Confusing, huh? Their salary is around 100 grand per year. You thought we're done? I'm sorry, you're wrong. There's a lot of other roles in the hospital that are in direct contact with you. Social workers. They will help you with so many things such as rides, your medication, your insurance, rehab placement, and so forth. Dietitians deal with what you eat, what you should eat, and what you should not eat. Health educator. They teach you about a specific disease like asthma, diabetes, and how to chronically manage it at home. Physical therapists and occupational therapists. They exercise you, they stretch you, and they get you ready to go home on your feet. Pharmacist deals with your medication, the dosing, prescriptions, and so forth. Respiratory therapist deals with your breathing, gives you oxygen, gives you nebulizers, give you masks and things like that. Speech and swallow therapist. Well, the name is pretty comprehensive. They test you if you can swallow well or if your speech is okay. Radiology technicians, they help getting x-rays or other pictures from you. There are so many other people with different roles that they come in close contact with you in the hospital, like nursing aides, technicians, transport people, and stuff like that, but we are short in time now. There's also tons of other people that work behind the scenes in the hospital, like administrative staff, laboratory staff, etc. This was a quick rundown of who you would see in the hospital to make things more clear for you. Just a quick tip. Remember, it's always okay to ask people who they are and what is their role. And it's okay to look at their badge, stare at it for a couple of seconds, and read their names and titles. Thank you for watching this video. Please don't forget to subscribe and share and comment below what you want me to talk about next. I hope you never go to the hospital. Stay safe.